Good afternoon, everyone. Thank you for attending today's virtual McLean County Community Behavioral Health Forum session. Today's topic is on the impact of COVID-19 on the mental health of older adults within our community. I am Tricia Malott. I'm the county's Behavioral Health Coordinating Council Supervisor. Part of this initiative originated out of the Mental Health Action Plan that the County Board adopted back in 2015. With the idea that increasing education and awareness surrounding mental health topics not only reduces the stigma, perhaps also helps connect individuals to resources within our county, but also helps provide our community members with more information. This year and at the end of 2020, obviously things had to shift a little bit in terms of how we do this. Historically, this has been a one-day in-person event, and we love the energy and the people that we get to see at that. COVID certainly changed how we were going to present it, so we have actually found many positives out of this. By doing it virtually, we know that people have been able to attend more sessions than they were able to in the past because there's no longer an overlap. We also know that attending over a lunch hour seems to be a little bit easier for folks than giving up an entire day. So we appreciate that you continue to join us and did so for today as well. Part of the layout for the virtual sessions, if you haven't attended before, is that all questions will be held until the end. Our question moderator is one of my employees who has also facilitated some of these on my behalf in other times, and that's Kevin McCall. So if you use the questions or the chat feature to ask any questions along the way, please do so, and Kevin will present them to Mr. O'Donnell at the end of his presentation. We do ask that you are specific in your question and provide context because it will not be asked in the exact moment that you may type it. That context is really important. So with that, I will go ahead and introduce our presenter for today. Mike O'Donnell is an advocate for older adults and a consultant on evidence-based healthy aging programs, behavioral health for older adults, elder rights, and livable communities for all ages. In March of 2015, Mike retired as Executive Director of the East Central Illinois Area Agency on Aging after 36 years of service. Currently, Mike is a master trainer for A Matter of Balance, an evidence-based falls prevention program for older adults, and is a consultant to Age Options in disseminating the program in Illinois. Mike serves on the boards of the Illinois Coalition on Mental Health and Aging and the National Coalition on Mental Health and Aging. Mike serves on the Blue Ribbon Committee for the McLean County Nursing Home and the Behavioral Health Priority Action Team for the McLean County Health Improvement Plan. Mike earned a Bachelor of Arts degree in Political Science in 1970 from St. Joseph's University in Philadelphia, and a Master of Arts degree in Urban and Regional Planning in 1979 from the University of Illinois at Urbana-Champaign, and clearly brings a wealth of knowledge on the topic. So Mike, thank you very much for agreeing to present today, and I will turn it all over to you.
Thank you so much, and I appreciate this opportunity. I want to also acknowledge some of the agencies locally who participated in telephone interviews and provided data for this report today, including the Area Agency on Aging for East Central Illinois, Community Care Systems, the ARC in Normal, PATH, Faith in Action, and the Long-Term Care Ombudsman Program. These are a few things that I hope that you can take away from today's session to better know the impact of COVID-19 on older adults in the U.S. and in McLean County, how COVID-19 has affected their mental health and signs and symptoms of depression in older adults, risk factors for older adults and substance use, resilience and strengths of older adults and challenges facing them and their caregivers and how to help them, and also how social isolation and loneliness affect older adults, and how to reach local agencies that are attempting to reduce social isolation. Just a little profile of older adults in McLean County. Our total population as of 2019 was over 170,000, of which 18% are 60 years of age and older. And you can see the breakdown, a demographic breakdown of persons of minority race, 7.7% 60 plus, 7.5% below poverty, 21% living alone, over 9% over 85. We have licensed skilled nursing facilities and assisted living facilities in the community, and we'll be talking about those a little bit later. Just to give you a profile of the cases and deaths related to COVID by age, in the US, as you've been hearing on the news, over 28 million total cases, about 14% are over 65. Total deaths, over 500,000. And the percentage of those deaths affecting people 65 years of age and older is 81%. We have over 14,000 cases in McLean County recorded as of February 25th, and 14% of those affected people over 65. Total deaths, 170, and those over 65, 92%. With regard to long-term care facilities, it was reported by the Kaiser Family Foundation in December that there were over 100,000 long-term care residents and staff in the United States who had died due to COVID. And deaths in long-term care facilities in the US represent 40% of all of those related deaths. COVID-19 cases in long-term care facilities in McLean County were 759, and total deaths in those facilities 121. Deaths in those facilities accounted for 71% of all COVID-19 deaths in the county. Older adults are at higher risk for serious illness if infected, and older people and younger adults with heart disease, diabetes, lung disease, asthma, and obesity do have a higher risk of becoming severely ill if infected. Older adults accounted for 80% of COVID-related deaths, and the CDC recommends that older adults limit in-person social contact. The pandemic has compounded social isolation and feelings of loneliness. Some facts about the impact on mental health. Reports of adults with anxiety or depression have increased since March of 2020 nationwide. 40% of the adult population 18 to 64 have reported symptoms of anxiety, compared to 24% of adults 65 and older. But this is still greater than the 11% of older adults with Medicare who reported depression in 2018. The important thing to remember is depression in older adults is not a normal part of aging. It may go unrecognized and untreated. Older adults experience increased rates of social isolation, loneliness, and bereavement. It should be noted that these rates of anxiety and depression among older adults were higher among those who were female, Hispanic, low income, and relatively poor health, those who live alone, or experienced recent loss of employment income in their household. Some things to take away from today's presentation is what are the signs and symptoms of depression in older adults. These can include persistent, sad, anxious, or empty moods, loss of interest and pleasure in hobbies and activities, feelings of hopelessness and pessimism, feelings of guilt, worthlessness, helplessness, fatigue, feeling slowed down, trouble concentrating, remembering, and making decisions, restlessness and irritability, trouble sleeping, early awakening, oversleeping, appetite problems, unexpected weight changes, thoughts of death, suicide, suicidal attempts, aches and pains and headaches, cramps, or digestive problems without a clear physical cause, and or those that do not ease even with treatment. Depression in older adults can co-occur with other health conditions, including diabetes, cancer, heart disease, Parkinson's, and Alzheimer's disease. Depression can make these symptoms, these conditions worse, and vice versa. Medications for these illnesses may cause side effects that contribute to depression. Of course, it's always best to consult with a physician in treating these illnesses, and they can help work out the best treatment. All of these factors can cause depression to go undiagnosed or untreated in older people. Treating depression will help an older adult better manage other conditions. And older adults with depressive symptoms should consult their primary care physician. Some facts about older adults and substance use disorders. Some physical risk factors include chronic pain, physical disabilities or reduced mobility, transitions in living or care situations, loss of loved ones, forced retirement or change in income, poor health status, chronic illness, and taking many medications. Psychiatric risk factors for substance use disorders include avoidance coping styles, history of substance use disorders, previous or current mental illness, and feelings of being socially isolated. The use of illicit drugs in older adults is lower than among older adults, but currently increasing. It should be noted that older adults can't absorb and break down drugs and alcohol as easily as they once did. They're more likely to unintentionally misuse medicines by forgetting to take their medicine, taking it too often, or taking the wrong amount. Some older adults may take substances to cope with big life changes, such as retirement, grief, declining health, or a change in their living situation. Most admissions to substance use treatment centers in this age group are for alcohol. Older adults using drugs or alcohol are at high risk for harmful drug interactions, cognitive decline, injury, sleep problems, mental health issues, memory problems, liver disease, and cardiovascular disease. Of course, physicians play a key role in increasing awareness among seniors about the relationship between substance use and health outcomes, including the risk for COVID-19. There are a variety of elder-specific techniques and patient-centered approaches for treatment designed for clinical practice to help identify, refer, and treat substance use in older adults. Seniors experience better treatment outcomes with providers that understand the unique issues and complexities of older adults. Why are older adults able, perhaps compared to other adult age groups, in coping with the impact of COVID-19 on their mental health? Studies suggest that older adults have a higher resilience to mental health effects. This resilience reflects internal factors such as biological stress responses, their cognitive capacity, and external resources. Feelings of isolation and loneliness are partially countered by coping mechanisms such as, of course, avoiding people who are showing symptoms, unnecessary travel, and avoiding the use of public transit or public places. But having more close or meaningful relationships may be protective rather than just having more interactions with others. And maintaining these connections during the pandemic may require better ability to use technology to connect with loved ones. Research also shows another strength is wisdom, a complex personality trait comprised of components including empathy, compassion, the ability to regulate our emotions, self-reflection, decisiveness while accepting uncertainty, and diversity of perspectives, social advising, and spirituality. 6.7 million, or about 17% of adults age 65 and older in the United States, are isolated. There are two components to isolation: social isolation and loneliness. Social isolation is the lack of connection with other people, one's community and resources and supports. But loneliness is the feeling of being isolated and alone. Loneliness is feeling alone, whereas isolation is being alone. Here are a few tips from the experts about how we can manage our mental health impacts of isolation. Establishing structure and routine in daily life. Remaining cognitively active. Exercising, staying physically active, and practicing meditation. Stop or manage drinking. Connect with others by phone, social media, Skype, or Zoom, and observe recommended practices for infection control, and of course, getting help from our community. I want to give you some insights as to how the providers of services to seniors in McLean County have mobilized to reduce social isolation. The Area Agency on Aging has formed committees in 4 counties, including McLean, to address this issue. The Area Agency has allocated federal and state funding to local agencies, including the Family First Coronavirus Response Act funds for home-delivered meals, Older Americans Act funds for community-based services, such as over 2,800 more outreach contacts with seniors per month in the past year. Older Americans Act funds for senior nutrition have increased the delivery of home-delivered meals by 70% over the past year. Also, additional funding for the Family Caregiver Support Program. There's been a distribution of over 45,000 FEMA shelf-stabled meals for seniors throughout the area in May 2020, and over just 26,000 cloth masks from FEMA and 2,600 face shields. COVID-19 response funds have provided supplies, interim housing, and utility assistance. Funding from the Department on Aging and the Department of Human Services through the Illinois Care Connections program has provided technology resources to provide social connections for older adults and persons with disabilities. Here are the organizations that comprise the McLean County Reducing Social Isolation Committee, including the ARC, Housing Authority, our public libraries, our 2 hospitals, community care systems, the Agency on Aging, Faith in Action, ISU, ISU's Mennonites College of Nursing, Living Well United in Leroy, Showbus, U of I Extension, Western Avenue Community Center, and the YWCA RSVP program. All of these organizations have begun screening for social isolation and loneliness. I even noted that during my recent annual physical, my doctor's office asked me some of the questions that you'll see below. Several RSI participating agencies screen older adults using the UCLA's 3-item loneliness scale. Questions measure relational connectedness, social connectedness, and self-perceived isolation. These questions include: how often do you feel that you lack companionship? How often do you feel left out? How often do you feel isolated from others? The scale uses 3 response categories: hardly ever, some of the time, and often. Scores for each question can be added together to give a possible range of scores from 3 to 9. 3 to 5 indicates not lonely, but scores of 6 to 9 show indicators of loneliness. Here's some strategies that our local organizations have used to counter isolation among older adults. The Activity and Rec Center, the ARC, has over 4,000 members. And even though many of their programs now are virtual, they've included some very innovative programs such as the Sunshine Program that has reached out to members who are temporarily homebound due to the pandemic by making over 3,000 phone calls and well-being checks, providing birthday cards and sympathy cards, adding digital programming, including Zoom, which includes the book club, yoga, Tai Chi, music education, line dancing, bingo, and grief support groups. The ARC has also distributed tablets and webcams through the Illinois Care Connections program. Here are a couple of examples. Evie, shown on the left, has been the recipient of social calls and birthday cards from volunteers from the ARC, and Joe received a tablet, enabling him to participate in online programming. Also, the Normal Township ARC is partnering with McLean County Health Department and Carl Broman to host a COVID-19 vaccination clinic that will run through April. The first clinic on January 28th vaccinated over 440 responders, teachers, and seniors in Category 1B. Clinics are held on Wednesdays and Fridays as vaccine is available. Since the start of the clinic, the ARC has vaccinated with these partners more than 2,500 people. Faith in Action of Bloomington Normal, their mission is seniors helping seniors 60 years of age and older, serving Bloomington Normal and the rural communities of Downs, Hayworth, Hudson, and Towanda, and they plan to serve Leroy and Lexington in the future. In 2020, Faith in Action mutually benefited 332 care receivers and 288 volunteer caregivers. They provide the only option in the community for through-the-door transportation, meaning that the driver will accompany the patient from the car to the admissions desk for outpatient medical visits, kidney dialysis, and physical therapy for up to 6 weeks after surgery, and essential grocery shopping. Faith in Action volunteers recorded over 7,500 hours of service, 8,500 one-way trips, and over 478 friendly visits. Rides and friendly visits provide volunteers and care receivers with meaningful social interaction and emotional well-being. During the pandemic, concerns about personal safety and closures of senior centers and exercise facilities decreased the number of active volunteers from 340 in 2019 to 288 in 2020. Vaccinating Faith in Action volunteers is expected to increase their confidence and safety, and as volunteers return to service, Faith in Action intends to restore unlimited therapy rides and personal rides. Piecemeal Senior Nutrition Program is currently sponsored by OSF and provides nutrition meals 5 days a week for seniors age 60 and older in a 7-county area, including McLean. During the pandemic, Piecemeal has suspended congregate meal services. However, they have delivered over 177,000 meals to the homes of 692 seniors in our county. In response to the pandemic, Piecemeal delivered 2 7-day meal packs of shelf-stable meals in May and FEMA emergency meal boxes. 93% of recipients report that Piecemeal enables them to continue to live at home to manage chronic health conditions. 11% of recipients have reported not having enough money to buy food. And home-delivered meal deliverers provide daily well-being checks and help seniors stay socially connected. Here's the team that staffs the Piecemeal Kitchen in Bloomington. There are several services provided by Community Care Systems. They're known as the Coordinated Point of Entry for seniors to provide senior information services for older adults in DeWitt, Livingston, McLean, and Shelby counties. They are the designated care coordination unit for McLean County, providing access to community-based long-term care services for people 60 years of age and older. But their team of professionals also provide information and referral, benefits assistance, the Senior Health Insurance Program Counseling Program known as SHIP, and the CCU conducts pre-admission screenings, assessments, and coordinated care planning to arrange for home care. Caregiver advisory services help caregivers of older adults and grandparents raising children. Their geriatric counseling service program includes the PEARLS evidence-based program. We'll talk about that a little bit. And evidence-based programs including CDSMP, that's the Chronic Disease Self-Management Program, the Diabetes Self-Management Program, Matter of Balance, Falls Prevention Program, Powerful Tools for the Caregiver, and they'll be introducing a new program called Stress Busting and also Tai Chi in 2021. CCSI collaborates with the Restoration Church and Western Avenue Community Center to reach out to Hispanic older adults. Their Brain Train program provides monthly packets of activities to residents of senior housing, such as games and puzzles. The staff screen participants using that UCLA loneliness scale that we talked about earlier. And the staff call participants twice a month to discuss activity packets and encourage them to engage in light exercise. CCSI staff provide COVID-19 care packages with protective equipment for older adults. They also conduct proactive wellness calls with clients. This photo depicts a recent activity where the staff got together to put those packets together. A few words about the Geriatric Counseling and Pearls program. The geriatric counselor at CCSI serves older adults with mild, late life depression using an evidence-based program known nationally as PEARLS, or the program that encourages active, rewarding lives. The program aims to improve quality of life as well as reduce depressive symptoms, and the PEARLS team includes a counselor, a supervisor, and a consulting mental health professional. Clients complete what is known as the PHQ-9 depression assessment initially, and then over a 9-week period, that depression scale is administered again to measure improvement or changes. They also use the UCLA isolation scale on a quarterly basis. During 6 to 8 sessions, Elena Moore, the geriatric counselor, empowers clients to take action and make lasting changes. CCSI reported a decrease in counseling clients from 138 in 19 to 37 in 2020. This was due primarily to a change in criteria to serve older adults assessed with mild depression and anxiety. During the pandemic, some older adults were also less eager to participate in counseling over the phone. But clients are now receiving the brain-trained activity packs and monthly calls with the counselor. Some observations from the counselor include depression in late life and seasonal depressive symptoms have been compounded by social isolation due to the pandemic. Seniors who normally live alone have concerns about exposure to COVID-19 through contacts with family, neighbors, and home care workers. We're hoping this will be ameliorated with greater access to the vaccine. Seniors don't want to be a burden, and we must listen to their concerns. The counselor helps clients to achieve small goals, such as personal grooming, before moving on to more complex goals. The counselor empowers clients to use PPE and to be assertive in their contacts with others. Clients are encouraged to be physically active, eat healthy, prevent falls, and engage in activities like the brain train, puzzles, games, and crafts. In 2020, Community Care Systems Caregiver Advisor Angie Raymer provided the following services in our county: 766 hours of services to 158 family members caring for older adults at home, and service to 38 grandparents raising children. They distributed the COVID-19 care packages and activity kits to elder caregivers, grandparents, and children. They adapted in-person support groups to Zoom meetings for older adults caregivers in collaboration with the Alzheimer's Association, Sugar Creek Alzheimer's Special Care Center, and OSF Healthcare. They also facilitated Zoom support group meetings for the Raising Our Children's Kids, known as ROC, sponsored by Illinois Children's Home and Aid Society. Let's turn to cases of abuse, neglect, and exploitation affecting older adults. Adult abuse includes physical, verbal, psychological, and sexual abuse, active and passive neglect, financial exploitation, and self-neglect of persons 60 years of age and older, and those 18 to 59 with a disability. Some signs to look for: self-care, condition of the environment, access to health care, unsafe situations, self-reports about safety and well-being, food insecurity, guns in the home, family relationships, caregiver stress, access to medicine, supplies, and technology. Risk factors for abuse and neglect include social isolation, cognitive impairment, physical frailty, and dependence on others. These, of course, could be compounded by economic problems due to the pandemic. PATH provides adult protective services in McLean and Livingston County. PATH is the statewide 24/7 after-hours call center for adult protective services. The number to use to report suspected elder abuse is 828-1022, or you can call the Illinois Elder Abuse Hotline at 866-800-1409. Just to give you some background and insight into how PATH is required to prioritize these reports when they come in. Priority 1 reports are when the person's life is in jeopardy, requiring the worker to respond within 24 hours and work with law enforcement. Priority 2 are when conditions are serious but not life-threatening, requiring the worker to respond within 72 hours. And priority 3 reports include situations such as alleged financial exploitation, requiring the worker to respond within 7 days. Well, due to the pandemic, the Department on Aging has restricted in-person visits with clients, limiting the ability to substantiate those reports. The caseworkers can contact clients by phone and put services in place to mitigate risk, but cannot close their cases until in-person visits can be made. APS workers have seen their average caseload double from 25 to 50 because of the number of open cases. In 2020, PATH received 275 reports of abuse, neglect, and exploitation in McLean County, averaging about 23 per month. Some clients fear infection due to COVID and will not allow anyone in their home, increasing isolation and risk for malnutrition and neglect of self-care and health. PATH has seen an increase in deaths also related to COVID-19. In 2020, there were 9 cases closed due to deaths of victims of neglect, and currently under investigation 3 suspicious deaths involving neglect. Some adults have moved back home with older adults due to unemployment and other stressors, increasing the risk of financial exploitation of older adults. The PATH collaborates with law enforcement, the coroner, the housing authority, Center for Human Services, community development offices in both Bloomington and Normal, Mid-Central Community Action, the Public Guardian's Office, and Prairie State Legal Services to investigate and mitigate abuse, neglect, exploitation, and self-neglect. Let's turn now to older adults who reside in long-term care facilities, and those include both certified nursing facilities and assisted living facilities. The risk of COVID-19 transmission in nursing homes and other long-term care facilities is high. Facilities must meet strict requirements to advance to each successive CMS phase. Facilities must follow the Illinois Department of Public Health and CDC guidance for testing, use of protective equipment, patient care, mitigating staff shortages, quarantine, and visits. Restricted family access has prolonged physical separation and isolation, impacting the health and well-being of residents. Recently, I was sent an obituary the family had published after the death of a gentleman who died due to cancer. However, the family said in their closing remarks in the obituary that what really contributed most to his decline and ultimately his death was the isolation that he experienced. He lost the will to live. The Department of Public Health rules permit visits from essential caregivers who meet essential needs such as assisting with activities of daily living or positively influencing the behavior of the resident. The goal is to help ensure high-risk residents continue to receive individualized, person-centered care. The plan of care should include services provided by the essential caregiver. So a tip for caregivers who are concerned about the isolation of their loved ones in nursing home is to have a conversation with the staff in charge of preparing those care plans for the resident. Also, in-person indoor visitation is generally prohibited except in situations when outdoor visitation is not practical. Indoor compassionate care visits are considered on a case-by-case basis. Facilities can work with the resident, families, caregivers, resident representatives, and the Ombudsman to identify the need for compassionate care visits. Situations are not limited to the end of life. Other cases should include a resident whose health sharply declined or whose close relative or friend recently passed away. Compassionate care visitors must be pre-screened 24 hours in advance and rescreened with the same protocol when they arrive, including temperature checks. Facilities must notify all visitors upon arrival that if they develop symptoms of COVID-19 within 3 days after visiting, they must immediately notify the facility. Compassionate care visitors are restricted to the room where the visitation will occur. Visitors must also practice social distancing and follow guidelines for preventing infection. Angie Baker is the long-term care Ombudsman supervisor and head of the Area Agency on Aging's Ombudsman team. She's reported that many residents have had no in-person contact for over 10 months with family and friends, and compassionate care visits, as we noted earlier, are limited. Residents with diminished capacity and dementia can experience heightened confusion, trauma, and feelings of abandonment. On a practical note, residents haven't been able to have a barber or hairdresser cut their hair in almost a year unless there is a CNA, a certified nurse's aide, available who is a licensed hairdresser. This has adversely affected the residents' morale. Some facilities are challenged with staff shortages and may contract with agency staff. Facilities may use telemedicine and must continue IDPH guidance for transportation, for transporting residents for necessary medical trips, such as limiting passengers to maintain 6 feet separation. Facilities provide residents with access to digital services to visit with family and friends, and that indeed has helped. Some facilities have adapted their facilities to enable residents to visit safely with their families, such as Courtyard Estates in Sullivan, Illinois. And you can see how they've built a room which is separated from the rest of the facility with plastic glass panels, with access to the outdoors, and with armholes to enable their visitors to give them a hug when they arrive. So I think we're all looking forward to the day when we can all visit with our families and friends and give them a hug. As I wrap up here, I want to make sure that you know that you can reach out to any of these organizations for information, assistance, and services, including the Activity and Rec Center, the East Central Illinois Area Agency on Aging, Faith in Action, Community Care Systems, OSF Piecemeal, PATH, and the Long-Term Care Ombudsman Program. This presentation is being recorded and the slides will be available, and you'll be able to access all of these websites and telephone numbers. I want to thank McLean County Behavioral Health team for hosting this series of webinars and giving me the opportunity to share this information this afternoon. I'm available for your questions. Thank you.
Thank you, Mike. So for our attendees, again, you can put any questions in the questions box, and we'll make sure to post them to Mike before we log off for the day. Mike, I just want to say, one, there is so much information in the presentation you gave, but I also love that you give some national data as well as local data, but I think it's really great that you highlighted what has been done locally to help our older adults within the community in the past year. And it's one, while it's hard to see in writing, knowing that there are people who haven't had any in-person contact for 10 and now potentially 12 months. Also knowing all of the efforts that have been made at our local level to try to do as much as we can for folks, and that all of those services serve such a great benefit even in the absence of COVID, but that they've been even more vital during this time to help connect people. So I just want to thank you for, one, making sure all that information is out there and brings to light a lot of the services that do exist within the community and what has been done. I think sometimes the hardships of COVID-19 have been highlighted and not always all of the ways that agencies have stepped up and have found new ways to do services.
You're welcome. And indeed, the theme for this forum is we're all in this together. And I think the contributions of the organizations that I've noted shows that it's a great team effort.
Yeah, I agree. Right now, I don't see any questions out there, but Mike has made his email address available on this last slide. And if you don't have a chance to jot it down now, as Mike indicated, the session today was recorded and will be available on the VHCC YouTube channel after the fact. And we don't expect you to remember where that is or necessarily find it, but there are links on the county website directly to each recording. And Kevin has put in the chat some of the links to help get you there as well. So we want to thank all of you for attending, and again, thank Mike for his presentation. Again, you're welcome to email him with questions, or if after the fact you can't find the information, you're always welcome to contact myself or Kevin, and we can get you in touch with Mike or any of the other agencies. I hope you all have a lovely day and enjoy the sunshine. I know for me, it's always a nice surprise to see the sun shining, especially in times where it's been so cold and gloomy for a period of time. So thank you again, Mike, and we will see the rest of you hopefully in another session.